So we have a lot of great things going on in cosmetic dermatology. And one of the things that, like, I look at you and you practice in Miami where patients, are potentially exposed to a lot of sun and going on the beach and doing things outdoors. And I practice in Colorado and have patients that spend a tremendous amount of time outdoors, whether it's summer or winter, at high altitude. So, what are the things that you talk to your patients about in terms of like the importance of sun protection, ways to sun protect in your climate versus other climates, and really get patients on board with the comprehensive package of things that we tell them to do?
I loved that portion of your lecture where you were talking about estrogen as a anti-aging in your climate. I think it's less so of an issue in my climate with the sun and everything. I think with the sun in my climate, it's an anti-inflammatory thing we have to concentrate on more in terms of treating melasma, et cetera, and then with sunscreens and protecting them, then more of an estrogen issue like it is, I think, in drier climates.
I don't know. I mean, my point was really with certain advancing age, we have a population of patients that really have high expectations and want to look like they did a few years ago. But as you get in the mid-40s and you get closer to 50 or early 50s, their skin just changes from that reduction in...
From the perimenopausal state, right?
But the reduction in estrogen and that statistic about losing 30% of your estrogen in the first 5 years of menopause. So if we can really hit with the right procedures and the right topical formulations and really the right sun protective strategies, I think we can hopefully help make people feel better and look better and feel more consistent with the way that they actually feel inside.
I love to hear you saying that because a lot of my female patients and I and my female physician colleagues are constantly complaining about what we think of as the patriarchy of medicine, where menopause and perimenopausal issues, whether they're aesthetic or non-aesthetic, have really largely been ignored by the medical community until now. And so I love gentlemen like you trailblazing in this area because it's so important. A lot more studies need to be done and a lot more things need to be developed for this particular issue because it's a big one.
And I love being called a gentleman because not that many people take that step. Thank you for joining us for DermTube meeting coverage from Cosmetic Surgery Forum.